Frontline is made possible by contributions to your PBS station from viewers like you. Thank you. With major funding from the John D. and Catherine T. MacArthur Foundation, helping to build a more just world. And additional funding from the Park Foundation, committed to raising public awareness. With additional funding for this program from the Colorado Health Foundation, the Commonwealth Fund, and the Colorado Trust.
Tonight on Frontline, American healthcare is in big trouble. It's the world's most expensive medical system, yet it leaves 47 million people without coverage and drives hundreds of thousands into bankruptcy each year.
I believe the problem is not that folks are trying to avoid getting health care. The problem is they can't afford it.
We are approaching a perfect storm of problems that, if not addressed by the next president, will cause our health care system to implode.
I am not running for president to put Band-Aids on our problems. I want to get to universal health care for every single American.
In the middle of our national debate, Washington Post reporter T.R. Reid journeys to 5 countries.
Have you ever paid a medical bill?
No, never.
And finds out how other rich, free market democracies provide health care for all.
How many people in Switzerland go bankrupt because of medical bills? Nobody. Doesn't happen. It would be a huge scandal if it happens.
Tonight on Frontline, what it's like to be sick around the world.
That's the capital of the richest, most powerful nation in history. But when it comes to providing health care for people, that great country, our country, is a fourth-rate power. The World Health Organization says the U.S. healthcare system rates 37th in the world in terms of quality and fairness. All the other rich countries do better than we do, and yet they spend a heck of a lot less. How do they do it? That's what this film is about. We're going to go around the world to see what lessons we can learn to fix America's sick healthcare system. I've covered the world as a foreign correspondent, and right now I'm writing a book about healthcare systems overseas. First stop on my tour is Great Britain, where our family lived for 5 years. Even though the UK is our closest European ally, its healthcare solution, that is, the government-run National Health Service, may seem too close to socialism for most Americans. Still, we can learn something here. For about half of what we pay per person, the NHS covers everybody and has somewhat better health statistics: longer life expectancy, lower infant mortality. Britain's National Health Service is dedicated to the proposition that you should never have to pay a medical bill. In the NHS, there's no insurance premium, no copay, no fee at all. The system covers everybody. And you know, when we lived here, my family got really good care from the NHS, although we often had to wait to see a doctor. And yet, the newspapers here are full of NHS horror stories, rationing, waiting lists, terrible mistakes. So I've come to London to see this NHS. Is it an answer for the US, or just some horrible socialist nanny state? The Brits pay for health care out of tax revenue, so the government owns the hospitals, like this one, the Whittington Hospital in North London. The doctors who work here are salaried government employees. Does that sound like socialized medicine? Well, according to the hospital CEO, David Sloman, the Brits like it that way.
I think people are proud of it. 90% of people who use the NHS think it's good or excellent, so people think very, very highly of it. People who don't use it don't think so well of it, actually.
Would you say most British people go their whole lives and never get a medical bill?
Every single person who's born in the UK will use the NHS at one point in their lives. The majority of people will use it as the only provider of their medical care, and none of them will be presented a bill at any point during that time.
No medical bills. Sounds sweet to me. And here's something else that's different. There's no medical bankruptcy. This is Jeremy Cadle. His son Tom is being treated for leukemia at the Whittington. At least he doesn't have to worry about going broke.
We've had 8 weeks in hospital. Apart from the times when he needs chemotherapy, we've got community healthcare who comes in on a weekly basis to take his blood.
Would that be all right?
Hasn't cost us a penny. You know, it's astonishing the care he can get.
On your picture?
Of course, it's not free. The Brits pay much higher taxes than we do to cover health care. But even so, does it sound a bit too good to be true? To find out, I sought out a longtime NHS watcher, Nigel Hawkes of the Times, for a more critical perspective. Look, this all sounds really sweet. Does it work?
It works in some respects. I think primary care, the family doctor service, is pretty good. Emergency care works quite well. Where I think it can fall down is on elective care. Hip replacements, heart operations, this kind of thing. It used to be of the order of 18 months to get a new hip. That's been greatly reduced by the current government over the last 10 years. It's down to certainly less than 6 months, and for most people about 2 or 3.
There are 400,000 fewer people on waiting lists than in 1997. Waiting times for...
In the last decade in Britain, Tony Blair and other politicians have reduced the waiting lists. They did it by spending more money and by bringing some market mechanisms into a government-run system. Today, government-owned hospitals like the Whittington compete against each other for government money. In today's NHS, patients can choose which hospital to go to.
Oh, of course we compete. You know, we do on our website, you book in, we'll make sure you can book into our place at least as quick as all the other places around here. But we're all competing around what I think are now respectable margins. Whereas previously, you know, it's 6 months or 7 months. Now in some specialties, I could proceed tomorrow.
It's easy to see why choice might suit patients, but what do government-run hospitals get out of it? We don't understand why people would compete when you can't make more money. In America, people compete to make profit.
Yes, that's a very fair point. I mean, here you would compete in order to survive, because if you start losing patients to another hospital, your services are going to be under threat.
What we've seen over the past 10 years is a move away from Bevan's ideal of an NHS for all. We've seen the creeping privatisation of services.
When I was in London, I stumbled on this rally in Trafalgar Square, and I discovered that many NHS staffers are angry about these new trends that could close some of the less popular hospitals. They were also protesting government plans to privatise some NHS services.
You're probably 50 or even more than that. Have you ever paid a medical bill?
Isn't it very kind?
Have you ever paid a medical bill?
No, never.
Will you ever pay a medical bill in your life?
I hope not. We don't want to. I hope not. This is why we're doing this. We don't want to. And even if in 10 years' time we're not around, we don't want our kids to do it either.
While the hospitals struggle with reforms, the GPs have embraced them. I went to visit one who practices in the West London neighborhood of Shepherd's Bush.
Patricia Wilton.
In Britain, healthcare starts here. Nobody can go directly to a specialist. First, you have to go to a gatekeeper, like Dr. Ahmed Badat.
Nasty cough.
He's a family doctor, a general practitioner.
GPs hold down costs for the system and give people what the Brits call a medical home. My family had one just down the street, and we liked it.
Usually go to and have an X-ray done, yeah? Open your mouth.
GPs are paid a fixed amount based on the number of patients they have. The average list is 1,800 people.
Infected.
And get this, they make a bonus for keeping their patients healthy. So when Dr. Badat does a good job of caring for patients with diabetes and heart disease, he gets paid more. How much more?
Well, it works out, not quite, it works out about 90,000 pounds.
So that's increasing your salary by $180,000 a year. That's not bad.
Yes.
Yeah, you're doing that. I'm reading the newspaper, it says docs are doing well here.
I can't complain.
Dr. Badat has had personal experience with U.S. medicine. He had a heart attack while on vacation in Las Vegas and was rushed to the county hospital.
The treatment was absolutely fantastic. But, you know, I was there 8 days. The total bill came to $67,000. I mean, that is preposterous.
Critics say Britain has the opposite problem. Care costs the patients too little here.
Do you have patients who come twice a week or something?
Yes. There's always like that.
Are they sick or?
No. I think just lonely people. They are just want somebody to chat to. But then there are people I never see at all.
Yeah.
When they come and register, I don't see them for 3 years, 5 years.
With access this easy, the doctor and the system have a strong incentive to keep people healthy. The result? Britain has become a world leader in preventive medicine. Just look at all these services GPs here aggressively promote and talk to their patients about. To sum up then, there's a lot to like in Britain. No bills, NHS waiting lists are getting shorter, there's excellent preventive medicine, but there's probably still too much government here for American tastes, even if the NHS is trying to be more market savvy.